Hey everyone, and welcome back to Health Hub. Today, we're going to discuss a critical health topic that affects millions of people worldwide: joint issues. You see, our joints are amazing. They provide support, flexibility, and allow us to move freely. But just like any complex system in our bodies, they can encounter problems. And when they do, it can significantly impact our ability to perform even the simplest everyday tasks. So in this video, we will explore 7 warning signs of joint problems that you should never ignore. The first sign I want to highlight is persistent joint pain. We've all experienced aches and pains from time to time, whether it's from a tough workout or maybe just sleeping in an awkward position. But when that pain becomes a regular visitor, especially in your joints, that's your body trying to tell you something's up. Think of pain as your body's alarm system. When something's wrong, pain is how your body gets your attention. If you're experiencing persistent pain in your joints, whether it's a sharp, stabbing pain or a dull, aching sensation, it's a clear sign that you need to pay attention. This chronic pain could be a symptom of various underlying issues like osteoarthritis, tendinitis, or bursitis. Ignoring it won't make it go away. It could actually worsen the underlying condition over time. Early diagnosis and treatment are key to managing joint problems effectively and preventing further damage. So if you're experiencing this, don't hesitate to reach out to a healthcare professional. They can evaluate your symptoms, determine the underlying cause of your pain, and recommend the most appropriate treatment plan. Addressing joint pain early on can make a world of difference in your overall joint health and your quality of life. The second warning sign we're going to talk about is swelling and redness around your joints. This is a pretty clear visual indicator that something's not quite right. You might notice that the area around a joint appears puffy, larger than usual, and might even have a reddish hue to it. This swelling and redness typically indicate inflammation. Inflammation is your body's natural response to injury or irritation. However, when inflammation persists, it can actually cause more harm than good. Swelling and redness could be a sign of conditions like rheumatoid arthritis or gout. Apart from being a visual cue, swelling can also cause a lot of discomfort. It can limit your range of motion, making it difficult to bend, flex, or move the affected joint properly. If you're noticing swelling and redness around your joints, don't just try to mask it with over-the-counter pain relievers. The best course of action is to consult a healthcare professional. They can properly diagnose the underlying condition causing the swelling and recommend the right treatment. This might involve medications, physical therapy, or even lifestyle modifications. Let's move on to the third warning sign: stiffness in your joints. We've all woken up feeling a little stiff in the morning, right? It's like our bodies need a few minutes to remember how to move after a night of rest. But when this stiffness goes beyond those first few yawns and stretches, especially in your joints, it's time to pay attention. Joint stiffness can feel like a tightness or resistance when you try to move, making it difficult to bend, straighten, or rotate the affected joint. You might find it particularly noticeable after periods of inactivity, like sitting for a long time or first thing in the morning. If you're experiencing persistent stiffness in your joints, especially if it's accompanied by pain, it could be a sign of an underlying joint problem like osteoarthritis. Sometimes stiffness can be caused by factors like dehydration, muscle overuse, or even certain medications. However, it's always best to err on the side of caution and get it checked out by a healthcare professional. They can help determine the underlying cause of your stiffness and recommend the most appropriate course of action. This might involve lifestyle modifications, like incorporating regular gentle exercise into your routine to help improve joint flexibility and range of motion. They might also suggest over-the-counter pain relievers or other medications to manage the stiffness and discomfort. Now, the fourth warning sign we're going to discuss is reduced range of motion. This basically means that you're finding it increasingly difficult to move a joint through its full range of motion, whether it's bending your knee, raising your arm, or even turning your head. Our joints are designed to move in specific ways, and when their ability to do so is compromised, it can really throw a wrench into our daily routines. Think about all the simple things we do without a second thought. Reaching for a glass on a high shelf, tying our shoelaces, playing a game of catch with our kids. When you start experiencing reduced range of motion, it's not something to take lightly. It can be a sign of joint damage or inflammation, signaling that something's interfering with the smooth operation of your joints. This reduced mobility can be caused by various factors, ranging from injuries like sprains and strains to chronic conditions like arthritis. Addressing reduced range of motion early on is crucial. Early intervention can help prevent further deterioration of the joint and preserve as much function as possible. So, if you're noticing that a particular joint isn't moving as freely as it used to, don't hesitate to reach out to a healthcare professional. Alright, moving on to the fifth warning sign, joint instability. Have you ever felt like your knee might buckle or your shoulder might pop out of place? That feeling is joint instability. It's an unsettling sensation that can range from a mild feeling of looseness to a complete inability to bear weight on the joint. Joint instability occurs when the structures that normally support and stabilize a joint are weakened or damaged. This can include ligaments, tendons, and the muscles surrounding the joint. When these structures are compromised, the joint can become loose, wobbly, and prone to painful movements. Several factors can contribute to joint instability. Injuries like ligament tears or fractures can disrupt the structural integrity of a joint. Overstretching or overuse of a joint can also weaken the surrounding tissues, leading to instability. Chronic conditions like arthritis can also play a role. Joint instability is not something to ignore. It can significantly impact your daily life, making it difficult to perform even simple tasks with confidence. So if you're experiencing any signs of joint instability, it's essential to seek professional evaluation. Let's talk about the sixth warning sign, that grinding or clicking sensation when you move a joint. You know the feeling, right? It's like sandpaper rubbing together, and it's often accompanied by pain or discomfort. This sensation is a telltale sign of joint degeneration. Our joints are designed to move smoothly and effortlessly. The surfaces of our bones are covered with a layer of cartilage, a tough but slippery tissue that allows for frictionless movement. But over time, this cartilage can wear down, especially with repetitive use, injury, or as part of the aging process. When cartilage deteriorates, the smooth surfaces of the joint become rough and uneven. As the bones rub against each other, they create that grinding or clicking sensation. This isn't just an audible or tactile nuisance. It can be a sign of underlying issues, most commonly osteoarthritis. While osteoarthritis is a common cause of this grinding, it's not the only one. Other conditions, like rheumatoid arthritis or even injuries to the joint, can also contribute to this sensation. If you're experiencing a grinding or clicking sensation in your joints, accompanied by pain or discomfort, don't ignore it. And finally, let's talk about the seventh warning sign, warmth around the joint. While a little warmth after exercise is normal, persistent, or unusual warmth around a joint, especially when accompanied by other symptoms, should never be ignored. Warmth around a joint is often indicating an inflammatory response, or in some cases, even an infection. Inflammation is your body's natural response to injury or irritation. When a joint is inflamed, you might notice that the area feels warm to the touch, and this warmth can be accompanied by redness, swelling, and pain. While most cases of joint warmth are due to inflammation, there's another possibility that we need to address: infection. Infections within the joint, though less common, are serious and require immediate medical attention. Joint infections, also known as septic arthritis, occur when bacteria, viruses, or other microorganisms enter the joint space. This can happen through direct injury, surgery, or even through the bloodstream. Joint infections are nothing to mess around with. They can cause rapid and severe damage to the joint if left untreated. If you notice warmth around a joint, especially if it's accompanied by other symptoms like intense pain, swelling, redness, fever, or chills, seek medical attention immediately. So there you have it, the 7 warning signs of joint problems you should never ignore. Remember, your joints play a crucial role in your mobility and overall quality of life. Taking care of them is an investment in your long-term health and well-being. If you're experiencing any of the symptoms we've discussed, don't hesitate to reach out to a healthcare professional for a proper diagnosis and treatment plan. And if you found this video helpful, please give it a big thumbs up and share it with your friends and family. Don't forget to subscribe to Health Hub and hit that notification bell so you don't miss out on any future health tips and advice.